we are exposed to acid loads because of our lifestyle. All of you are familiar with Dr. Warburg and his research and his conclusion that cancer thrives in an acidic, oxygen-depleted environment. So if you want to increase your risk to develop cancer, do the things that make your body acidic and do the things that deplete oxygen in your body. So stop exercising and eat foods that are very acidic, which are the processed foods, which are the foods that are high in animal proteins. So this is the list. And soft drinks, we know it's like a poison. It's really terrible. Okay. Now, what's interesting is Dr. Warburg was on the right track. His studies back in the 1930s showed that cancer cells are very active metabolically, but they don't require oxygen. And if we would have followed his line of thinking, we could have saved 70 or 80 years of research and been so much further along. But somewhere in that same period of time, we started to blame our health on our genes. And we got off on a tangent here because our health is not dictated so much by our genes as by the environment that we put ourselves in, both physically and internally. Dr. Filser mentioned there are buffers in our body. The lungs are the best buffer. The kidneys are, and the lungs are a long-term buffer. They're fast-acting. Then the kidneys, and then we have these chemical buffers. And these chemical buffers is where the ionized water can contribute to neutralizing the acidic buildup in our systems. This is also where the link between acidity and osteoporosis is believed to lie. Because if you look at the slide here, when we have a very acidic diet, whether it's from high animal protein intake, or it's from soft drinks, or it's from high fructose corn syrup, and those foods that most of us eat too much of, our body's trying to maintain a state of neutrality. And one of the best places to get a buffer for that system is from the bones. So it takes calcium carbonate, calcium phosphate out, and calcium gets excreted, and we lose bone density. Here's a list of the alkaline and acid foods. And some of you have seen this before. But look at that list. Study that. And remember that you already know what you should eat. Nature has provided these foods for us. But if you look at the convenient foods and the foods of the 21st century and the foods that we like because they taste good, and sometimes they're cheaper than eating the raw vegetables and fruits, you'll see, if you're honest, that most of the time, many of us eat more of the acid foods than we do the alkaline foods.